Good evening, everyone. A warm welcome to this free session of neurotherapy. And this is Lajpat Rai Neurotherapy. And we have our famous Acharyaji Ramachandran sir here today. And please note that today's topic is type 1 diabetes versus type 2 diabetes. And many of our and people in our families suffer just because of this diabetes. So I request all of you to please concentrate in this session because this session will be helpful to you, to your neighbors, to your family members, kith and kin, friends, anybody. So this message can be helping you, this class can be helping you in learning about the further paid classes of diabetes, which will make you have a clear picture of how and what you can do to clear the diabetes from anybody, yourself or anyone, from the root cause. Because root cause is important. Even if you take medicines, whatever medications, whatever food, everything, lifestyle, everything is followed, but sometimes diabetes is something that it doesn't leave you at all. And especially in the medical world, you have to take medicine for diabetes and BP for years together till you die. So with other therapies, like we have alternative therapy of neurotherapy here from Lajpat Rai Master Guruji, and we have our Guruji Ramchandran sir here who will teach us about what are the ways to treat sugar or diabetes in our bodies. Because now we see that even a small newborn child is suffering. And due to this diabetes, there are many critical problems in the child or the person or the family, affecting the family altogether. So we request each one of you personally to please take notes, keep your books, papers, pens, everything ready, and make a note of your doubts in a different page so that you can clarify all of them. And please remember, if all of you are unable to clarify at the same go, then I would request you to please mention it in the main Joshys Kerala Telegram group with at Ramachandran sir at query and write down your query clearly. Okay. So now, without wasting further time, and let us now give a warm welcome to Ramachandran sir. Good evening, sir. A warm welcome to you. Please take over the session, sir. Thank you.
Thank you. A hearty thanks to Joshi Kerala Group, to Anusha Madam, and to all the participants who have joined here on this wonderful occasion. This is a 2-lecture session. This week and next week, we'll be handling this topic. That is causes, symptoms, etc. of type 1 and type 2 diabetes. Okay, we will have something to go with it, like a PPT will be a Word document, so you can all read also. But more than that, you please pay attention, because everything is not written. Some things I will be adding along with the writing, so please pay attention. Okay, and thank you once again for joining me. And now we go to the main session. Let's now share. This is our respected master, Guruji, Dr. Lajpat Rai Mehra. Okay, it's actually he was in a class blessing people, blessing students, and that was taken at that time. Now we are coming to the causes of type 1 and type 2 diabetes. 1 minute. So I will increase it slightly so that you can all see it. So as you can see, for type 1 and type 2, the cause is not the same. The cause is always different. And the basic cause for type 1 is autoimmune destruction of insulin producing beta cells in the pancreas. Now, many of you may be knowing what it is, but I'll just give for people who may be new, like patients, etc. The word autoimmune, what does it mean? What does autoimmune imply for an average person? An autoimmune disorder is a disorder in which our own body cells are attacking our own body cells. You know, like a good security system in a city or in a village, you have a security system. You have a policeman, constables, etc. And what is their job? To keep outsiders, thieves, etc., robbers, etc., out of the way. So for this, they have got certain instruments. Now, what happens if suddenly, after killing all the outsiders, suddenly the policeman hits a person in the village, from the village, of course, unknowingly. Okay, he is not knowing that this person is actually from our village. He thinks he is an outsider and he eats him. This is exactly what happens in an autoimmune disorder. In an autoimmune disorder, we have a thymus gland in our body, and the function of the thymus gland is to produce certain special training force, let us say, policemen. Okay, special policemen. And those policemen's job is to identify and kill other intruders. But due to some reason, normally it is due to stress and tension, the person gets stressed up, tensed up, and then he is unable to handle the situation, perhaps. And at that time, his control over these policemen who are having the special force, the control temporarily gets lost. And then that policeman just does what he wants. So depending on where the attack takes place, the name is given differently. In diabetes type 1, the name diabetes type 1 means the thymus gland cells are attacking the pancreas, the pancreatic islets. And those islets of Langerhans, they are called, and they are the ones which are producing beta cells in the pancreas. Okay. So the beta cells, alpha cells, everything is made by the islets of Langerhans. Okay. So the insulin producing beta cells are targeted by this in this disease. So this is the autoimmune destruction. Okay. Now we come to type 2 diabetes. In type 2 diabetes, it is due to insulin resistance and gradual beta cell dysfunction. That means in this, there is no outsider, no insider killing our own cells. Everybody is working properly. But what is happening? Insulin resistance means the body says that there is insulin in the body, but the body says, I don't need it. I don't want insulin. So this typically happens when a person eats carbohydrates of food, but he does not do enough bodily exercise to burn away the calories. So at that time, this happens. And as a result, when this happens, when every day the beta cells are making insulin, but the body is saying, I don't want, I don't want, I don't want. So finally, a stage will come when the beta cell starts dysfunctioning, not functioning properly. So that is what is happening in type 2 diabetes. Okay, so type 1 diabetes is usually an autoimmune destruction, whereas type 2 diabetes is due to insulin resistance. Okay, then what is the onset age? In type 1 diabetes, it is usually in childhood or adolescence. Adolescence means teens, 13 to 19. Okay, so that is the time. And that is called, because that age is called juvenile age. So that diabetes is called juvenile diabetes. But it can occur at any other age also. It can occur at the age of 40 also. Okay, but usually it is seen in childhood or adolescence. Okay, then here type 2 diabetes typically develops in adults over 40, but increasing in younger individuals. Nowadays, even younger individuals as young as 25, 20, 22, from 40, half the age, 20, 22, even they are succumbing to this disease. Why? Due to lifestyle changes, because they are eating fast food, they are not keeping regular times of sleeping, times of eating and sleeping is not regular, etc. So resting is improper, all these things. Then insulin production. In type 1, little or no insulin is produced. Why? Because the beta cells are destroyed by the thymus gland. Okay, but here insulin is produced, but not effectively used. And that is why it's called insulin resistance. Later, beta cells may wear out and insulin production declines. So first the beta cells are okay. But later on, because of continued insulin resistance, they wear out. And that is why they say you have to take the tablets for the rest of your life. Okay. That is, of course, in the realm of allopathy or medicine. Now we will show you in neurotherapy, we have got success in the previous diabetic challenge class. We have got very good success. Almost everybody who has been regularly doing the treatments have been benefited, and a few number I have already put the feedback. Even more is coming through. So like that, I tell everybody that please, if you want to go to medicines, we have no objection, but start taking this treatment as a complementary treatment. Complementary treatment means in addition to whatever you are doing, and then you will see the results. Okay. So here it is autoimmune role. The immune system mistakenly attacks the beta cells. Here there is no direct autoimmune cause, but chronic inflammation may play a role. Inflammation. Now, in this inflammation, I want to say our body has a gland called the adrenal cortex. Now, the adrenal cortex produces a chemical called cortisol. Cortisol. Okay. And what is this chemical? This chemical immediately controls inflammation. And we have a specific neurotherapy treatment for this, which we will see later. So that treatment will immediately decrease the inflammation, the effect of inflammation in the body. Okay. So that is how we are treating autoimmune disorders or other things. We are treating only by that. Why this cortisol, while controlling the chronic inflammation, also it has another role of suppressing the thymus function. So when the thymus malfunctions, like it is doing in this case, in the case of autoimmune disorder, but here there is no autoimmunity, but still the thymus may be malfunctioning, it will suppress it. So the direct autoimmune cause does not happen. Okay. Then genetic influence. Strong genetic predispositions linked to specific genes like HLA, DR3 and HLA, DR4. These are genes which are identified as getting transferred from parent also sometimes, but more than that, they are causing genetic mutation. So people who are having these HLA, DR3 or DR4 are more likely to get autoimmune disorders. Okay. Now here the strong genetic component is there here also, but it is influenced more by lifestyle factors. Here it is not due to genetic predisposition from the family. It is due to lifestyle factors. And here different genes are associated. One is called TCF7L2. Well, the name is not important. We tackle genetic problems also by suitable neurotherapy treatments. Okay. Then we come to environmental triggers. Now, among environmental triggers, we have got viral infections like the Coxsackie virus, the Epstein-Barr rotavirus, etc. And these are all very relevant for diabetes 1. Then stress and toxins can trigger autoimmune response. I told you earlier, stress and toxins can trigger autoimmune response. Now here in diabetes type 2, it is not all these factors. Poor diet, lack of exercise, obesity and stress, they contribute to insulin resistance. I told you diabetes type 2 is more based on insulin resistance. So these contribute to insulin resistance. Then obesity role. Type 1 is not typically linked to obesity, whereas type 2 is very strongly associated with obesity, particularly visceral fat. Visceral fat normally shows up as fat around the abdomen. Okay. Viscera means internal organs like liver, pancreas, spleen, intestines, etc. They are all internal organs. So the fat in them is called visceral fat. Okay. Now, insulin resistance. There is no insulin resistance, but just lack of insulin. Whereas here, it is insulin resistance is the primary issue in early stages. Later on, it turns to other things. Then pancreatic beta cells. Here, the beta cells are already destroyed by the immune system. Whereas here, they are initially functional, but they are stressed out and they deteriorate due to overwork. Okay. The beta cells burn out actually. They deteriorate due to overwork. Then role of inflammation. In autoimmune inflammation destroys beta cells. Autoimmune inflammation destroys the beta cells. But here you have got chronic low-grade inflammation. Now, here also our treatment starts working. But because there is lack of insulin, so we have to treat it in a different way. When at the end of this today or next day's session, we will teach you what are the neurotherapy formulas we are doing, why they are effective. Everything will be taught in great detail because we want you to be self-armed. It's forewarned. Okay, so we want you to be self-armed and self-prepared. Okay, so this may be linked to hormonal imbalances or early life immune programming. So this happens, hormonal influence may be there in diabetes type 1. But type 2, the 3-4 factors are there. Number 1, it is called excess insulin because the insulin is not used. The pancreas says, I don't want insulin at all. My body is not doing any exercise. I don't want insulin. I don't want sugar. So that is why excess insulin is there. Then leptin resistance. This is leptin is a hormone which is related to satiety and hunger. So leptin resistance causes the diabetes type 2. And chronic stress hormones, cortisol, they worsen the insulin resistance. Okay. But actually we have found that in most people cortisol, when we give cortisol through our body, through our neurotherapy system, then it doesn't produce any side effect. In fact, it is very beneficial, which we will see. Now, lifestyle factors. Less influence from lifestyle, though stress and infections may play a role. Stress and infections may play a role, but there is lifestyle factors are not the primary cause. And here, type 2 major role is played by diabetes. The type 2 is played by lifestyle factors. Unhealthy diet, sedentary lifestyle, and stress contribute significantly. Okay. And reversibility. Is diabetes reversible? He says, 1 minute. Okay. Is diabetes reversible? Then it is not reversible. Type 1 is not reversible, but it is manageable with insulin therapy and neurotherapy. Type 2 diabetes can be managed or even reversed. How? With diet, exercise, and lifestyle modifications. That is why for type 2 diabetes, I always say DET. D for diet, E for exercise, only last resort is treatment. Understand? So DET is very essential in type 2 diabetes. Now, what are the takeaways from this? What do we understand? Type 1 diabetes is an autoimmune disease that destroys insulin producing cells. It is not caused by lifestyle, but rather genetic and environmental triggers like viral infections. That means a person suddenly succumbs to a viral infection and then he may get type 1 diabetes as a result. But type 2 diabetes is caused by insulin resistance and lifestyle factors such as poor diet, obesity, lack of exercise, etc. It can be prevented or even reversed with the right intervention. See, it is written diabetes type 2 can be reversed. So is it not a very great news? And that too with neurotherapy, we are seeing that it is getting reversed. Your own friends who are, maybe some of them are in this group also, they have confirmed, their videos are there, which say that they have been able to get sufficient control. So eventually they will get reversed. At least now they are getting control, which they were not getting all these days. Okay. Now let us compare the symptoms. We saw the causes. So many causes were there. We saw. Now first we will compare the symptoms. So type 1 diabetes, onset age, we have already seen it usually in children, teenagers or young adults. Whereas here, type 2 diabetes usually in adults over 40. But nowadays, increasingly taking place in younger people. Okay. The onset speed, how quickly the disease spreads. Sudden, within weeks or months. As I told you, it is because of viral infection. Immediately, the person you are taking treatment for viral infection, and suddenly you see you have diabetes, and the 2 type 1. But here, this is very gradual. That is why for several years it is not even caught. Nobody knows they have diabetes unless it becomes too late sometimes. So that is, it may take over months or years. Okay. Then weight changes. Unexplained weight loss due to muscle and fat breakdown. But here the weight changes, often overweight or obese people, they get type 2 diabetes. Whereas here in type 1, it is unexplained weight loss. They will look very thin and lean, and they are having type 1 diabetes. Then next is frequent urination, that is called polyuria. Frequent urination, polyuria. It is common in type 1 due to high blood sugar drawing water out of the tissues. Drawing water out of the tissues means the tissues become dehydrated. Okay. But this is common in type 2 also, it is common, but it may develop slowly. That is what said, it is not so immediately detected. Then along with frequent urination, excessive thirst. This is called polydipsia. Here, because the sugar is drawing water out of the tissues, so it is severe due to dehydration. So they have to constantly replenish their water sources. That is called staying hydrated. Here it is present but less noticeable. Then extreme hunger, it is called polyphagia. Increased hunger due to inability to use glucose. See, we eat so that we get energy. And when the body does not get energy from glucose, because the insulin itself is not produced. Insulin is the key for glucose to enter the cell. Insulin is not produced. So the body is not able to get energy. So then it starts burning fat, and that's why they start becoming thin and lean. They start losing weight. And increased hunger, they often keep on feeling hungry. Here, extreme hunger is present but often linked to insulin resistance. So if the insulin resistance is very high, then they will feel hungry, otherwise they won't be hungry. The fatigue and weakness. Fatigue and weakness is severe and sudden for type 1 and gradual, worsens over time. That means in the initial stages, you won't know you are having fatigue or weakness, and then slowly over the years, you start developing it. And that is the time when your HbA1c levels become poor. Okay, like that. Then blurred vision. very common in the type 1, because the changes in the fluid balance in the eye, because the body is getting dehydrated, no? So when it is dehydrated, the fluid balance in the eye changes, and so blurred vision is a regular problem. Here it is common but may worsen over time. That means it slowly goes on. The vision is not overnight, it does not become poor. Whereas in diabetes type 1, it may become poor all of a sudden. Slow wound healing is less common in the early stages of diabetes type 1. That means in the early stages, because it's an autoimmune disorder, their thymus gland is working properly. So the wound healing may be quite fast. Okay. But here, slow wound healing is very common in type 2 diabetes, and wounds and infections take a longer time to heal. Okay. Many of these people who are actually having diabetes, they will appreciate all these points. Many of the points may be common. And in our diabetes challenge class, we teach you how to tackle all these things individually. Each symptom is given a treatment. So that will all be going on. Frequent infections, okay, more common in uncontrolled cases. Only in uncontrolled cases it is more common. I'm trying to do this. Anusha madam, please disable annotation for others. I am not able to do it.
Sir, you can do it from your share screen.
Yeah, I am trying. I am trying. It is not. It is the thing is there, but I am not able to do it.
Okay, I request everyone not to please put any of your fingers on your mobiles, Swami.
See, one Mr. Swami is.
Yeah.
Yeah.
Please don't use your screens now. Don't take any screenshots. Okay, the recording will be provided. Please don't worry. So please don't take any screenshots. Only thing is, for providing recordings, your regular attendance is required. That's it. Okay.
Okay.
So please be in the session. Thank you.
Thank you. Okay. So, irritability and mood swing. Sudden changes due to fluctuating blood sugar. When the blood sugar becomes suddenly low or very high, then naturally there will be irritability and mood changes. Okay. Here in diabetes type 2, because it is not sudden changes of sugar, it's not there, it is very slow. So gradual mood swings, depression or anxiety. And for this, we have specific treatments. Okay. Then nausea and vomiting. In diabetes type 1, there is one problem which is called ketoacidosis, DKA, diabetic ketoacidosis. So for them only, this problem will arise. Okay. 1 minute. I think I am the co-host. Why am I unable?
Sir, stop share and start share again, please.
Yeah, I think that's what I will. Yeah. Yeah, now it came. That's right.
Requesting everyone, please don't put your fingers on your mobiles or laptops. Please don't use your mouse, okay?
Now it's okay. Now I got it's got now. Okay, so now I continue. Sorry for the disturbance. This diabetic ketoacidosis, there is something when the body starts burning fats for energy. Because in type 1 diabetes, energy is not there because from sugar. So the body will start burning fats for energy. Fats or sometimes proteins, etc. So some of these reactions will cause a particular buildup of this thing, acid called ketoacetic acid. So this ketone and the product byproducts of it are called ketones. So, and that is called ketoacidosis. So this ketoacetic acid being formed in large quantities is the problem in diabetes type 1, but in diabetes type 2 it is less common. Okay, so and that causes nausea and vomiting, and also another, it causes fruity breath odor. You know, type 1 diabetics, when they come near you, you can smell a type of fruity flavor. It is somewhat pleasant only sometimes, so they will not know, but others around them can know that they are having fruity breath odor, especially for type 1. It is rare in type 2. Okay, then dry mouth and dehydration. This is severe. They always have dry mouths due to high blood sugar pulling the fluids because of dehydration. Whereas here it is less severe. It is also common, but it is less severe. Okay. Then numbness and tingling in hands and feet. In type 1, it is rare, but type 2 very common because it is due to nerve damage, and that is called diabetic neuropathy. Okay. Then darkened skin patches, that is called acanthosis nigricans. No, it's a darkening of the skin that is rare in type 1, but very common in insulin resistance, especially the regions are neck, armpits, and groin. These are the three regions which get darkened skin patches. And for that, by giving our treatment, we have seen this as the insulin resistance goes down, they start getting the blackening goes down. Then increased ketones in urine. We are talking of ketoacidosis. So in ketoacidosis, as the ketones have to be broken up, they are broken up and they are removed out, excreted through urine. So that is why ketones in urine will be there. When you do a urine test, type 1 will show ketones in urine, whereas type 2 it is very, very rare. Then high blood sugar levels. This is, all of you know, we have been speaking about it. It is extremely high, fluctuating dangerously, but it is chronically high but stable. So it doesn't fluctuate. It maintains at a certain level. The low blood sugar episodes, this is called hypoglycemia, because diabetic type 1 people, they have to use insulin, and because their levels are fluctuating high and low, so suddenly they can go to hypoglycemia when their sugar level becomes very low. Then hypoglycemia is there, possible. And in type 2 it is less common. It is possible with certain medications. Some people who are having medications may have this hypoglycemia. Then muscle cramps occurs due to dehydration and electrolyte imbalance, and here it is due to poor circulation. So that means the treatment for this will be different, and the treatment for this will be different, though it is the problem is the same, muscle cramps. Now I give you a tip. Muscle cramps, which are the two elements required for muscles? One is sodium, another is calcium. For proper functioning of muscles, we require sodium and calcium at the proper level. Now, normally sodium level, except for people with high blood pressure, sodium level does not fluctuate too much. Okay, and sodium, when it is low, then it can cause muscle cramps. But sodium normally does not become low so all of a sudden. But there are cases where it becomes low. When will that happen? When we go out in the sun or we perspire profusely during an exercise session or something like that. So in that case, what will happen? We will sweat a lot, and then immediately some sodium will come out of the body. Some salt will come out. No, your perspiration, we know that perspiration is slightly salty. So that is only at that time, the salt, when it comes out, you are likely to have sodium insufficiency. Otherwise, most of the time it is due to calcium deficiency. So how to know which is this thing? In calcium deficiency, it normally takes place during the night, especially when you are turning to one side. You want to turn to one side and suddenly your leg cramps, and then you say you can't do anything. You just say and then it becomes sometimes become okay. For this, for everybody, I give a tip, a very simple tip. If this happens, all that you have to do, you have to click like this. You have to click your fingers. Okay, you have to click your fingers like this. Okay, like this, you can click your fingers, and then immediately the click your fingers and slowly raise them above the head, like this. Slowly raise them as high as possible. So click your fingers and raise them as high as possible. Then that is a good solution. Of course, it's a temporary solution. It's not a permanent cure. So that is for muscle cramps due to any type, whether it is due to sodium or calcium. This clicking the fingers helps. Okay. But in the treatment will be, we have to increase the circulation in type 2, whereas here we have to take care of electrolyte imbalances. Then diabetic retinopathy, it can develop over time if untreated. And here also it is common in long-term cases. People who are having, say, diabetes for more than 10 to 12 years, for them this becomes common. Similarly, high blood pressure, it is in type 1, it is less common initially, but in type 2, it has become common. Especially it is called metabolic syndrome. Okay. Then heart disease and stroke risk, increased risk, especially if blood sugar is uncontrolled. Then you are likely to go into heart disease or stroke, risk of stroke. Here also very high risk, but it is more due to obesity and metabolic issues, not due to sugar. Then kidney disease, diabetic nephropathy can develop if uncontrolled in type 1 and common in long-term type 2 diabetes. That means in both cases, kidney disease is possible, especially for people who are on long-term medication. The kidneys become weakened due to time, and they start deteriorating, they start malfunctioning after a long time. Then family history influence. For type 1, there is a weak genetic link, but it is more linked to autoimmune factors. There are strong genetic link runs in families. Type 2 diabetes runs in families. So what are the key differences in the symptoms? Number 1, type 1 diabetes develops suddenly, often within weeks or months. Symptoms can be severe and appear out of nowhere. Type 2 diabetes develops gradually over several years. Many people don't notice symptoms until complications arise. So that is the difference. Again, age of onset, we've seen this. This is actually a revision. So we have seen this type 1 diabetes starts in childhood or teenage years or early adulthood below 30, but it can occur at any other age also. Type 2 diabetes is more common in adults over 40, but due to lifestyle changes, more young people and even teenagers are developing it. Then body weight and insulin connection. Type 1 diabetes is an autoimmune disease. So people with type 1 tend to be normal weight or underweight, whereas type 2 diabetes is due to insulin resistance. So this is strongly linked to obesity and life factors. Ketoacidosis is very great problem in type 1 diabetes, because the fat breakdown produces ketones, as I told you. So it can cause fluty breath, it can cause nausea, it can cause vomiting, and finally confusion. That means you ask them questions, they may not be able to reply properly. Confusion. Whereas type 2 diabetes rarely has this problem, but in some cases, a very severe condition called hyperosmolar hyperglycemic state can occur. This is a very rare case, and that can cause extreme dehydration and confusion. Whenever there will be dehydration, there will be confusion, because the body requires the sodium and electrolytes in the proper level. Whereas when you have dehydration, either it can be due to vomiting or it can be due to loose motion. Whatever way it happens, then the body, those essential minerals are lost. And that is why ORS is very essential in combating dehydration. ORS, oral rehydration solutions. So they are very useful because they provide the appropriate amount of salts which are needed for the body. So whenever there is dehydration, first thing you should see is to take ORS, appropriate ORS for you. The doctor will normally prescribe that. Then weight loss versus weight gain. Type 1 diabetes, we saw that it leads to rapid weight loss because the body is unable to use glucose for energy, starts breaking down muscles and fat, as I told you earlier. Whereas type 2 diabetes is usually associated with gradual weight gain. This is hair loss and weight gain, and especially around the abdomen. I told you that around the abdomen, fat starts accumulating due to insulin resistance. Then similarly, fatigue and energy levels, we have seen already. Type 1 diabetes causes sudden and extreme fatigue due to body's inability to use glucose. Whereas type 2 diabetes leads to gradual persistent fatigue, worsening over time due to fluctuating blood sugar levels and insulin resistance. Then blurred vision. Type 1 diabetes causes sudden changes in vision due to rapid shifts in fluid levels in the eye, and type 2 diabetes causes gradual vision problems, and that increases risk of long-term complications like diabetic retinopathy. Then nerve damage, neuropathy. Type 1 diabetes does not cause nerve damage in the early stages, but long-term uncontrolled blood sugar can lead to neuropathy. So that is why quickly resolving the solution by taking the proper medication at proper times and also taking our treatments at proper times. Type 2 diabetes is often diagnosed after nerve damage has already started, and that is leading to numbness, tingling, and pain in the feet and hands. And we have found in neurotherapy that this is very much due to methylcobalamin, absence of vitamin B12. Vitamin B12 active form is called methylcobalamin. So methylcobalamin is absent, is a problem in diabetics, and that causes all these things: numbness, tingling, pain in the feet and hands. All these are caused due to vitamin B12 deficiency, methylcobalamin. Then skin changes. Diabetes type 1 may lead to dry skin, but infections are less common because their thymus gland is already working very hard, very high. So till blood sugar goes very high, the infections don't happen. But type 2 diabetes is associated with frequent skin infections and slow wound healing and dark patches of skin, and that is all due to insulin resistance. Then family history and genetic influence. Type 1 diabetes has a weaker genetic link. It is more related to autoimmune factors, but type 2 has a strong genetic link. But meaning if a parent has it, there is a high chance that the child will develop it, especially with poor lifestyle habits. Now about family, this thing, genetic link, hereditary tendencies, we call it. I want to tell one thing. Now we have seen in our case, 1 minute. We have seen in our neurotherapy cases that if the person's mother and father are both having diabetes, and the child has not yet developed diabetes, at that time, if they take proper neurotherapy treatment and if they do proper diet modification, absolutely, diet modification is the key. Then the parents may still have diabetes because they are coming from a different background. But since the child is exposed to all these problems are not there with the child, so the child is less susceptible to get the diabetes and may not have diabetes at all, because it is taking neurotherapy treatment. It has modified the lifestyle changes have been made, etc. So please understand this. If you are a diabetic, do not worry that your child will definitely have diabetes. It can happen, and it will happen only because the child is following your own type of food dietary habits. But suppose you are able to take neurotherapy treatment and change the dietary habit, your child will not develop it. So please understand this, because many people, they get resigned to the fact. They say, oh, I am having diabetes, my wife is also having diabetes, so definitely my son or daughter is going to have, or he will develop diabetes. No, sir, not needed, provided you come to us at the correct time. Understand? So please understand this, that diabetes, especially type 2 diabetes, need not develop at all if there is proper lifestyle change, proper yoga exercises are done. 2 or 3 specific yoga asanas you all must be knowing already. Vakrasana. Vakrasana is a very famous this thing for this thing. Ardha Matsyendrasana and Vakrasana, they are very famous for curing or treating diabetes. So Ardha Matsyendrasana and Vakrasana you can do, you can teach your child to do. And at a younger age, it is very easy for them. Their bodies are very flexible, so they can do it. Even if they are 25, 30, they can do it. If you tell them that, see, this is to prevent you from getting diabetes, you please listen to these things. Okay. And tell them your problems. See, I am likely to get all these 10, 20 different types of symptoms. So you should not suffer from them. That is why I am telling you all these things. Like that we can say. Okay. So this is it. Fine. Now we continue. Now here for
The Vakrasana and another asana is?
no, another is a Ardha Matsyendrasana.
Okay, sir. Thank you.
Of course, there are many more other asanas also, but these are the easier ones. There is one Mayurasana which is very difficult, which is also working on the pancreas. But these two are very simple. Ardha Matsyendrasana, Vakrasana is an easier this thing, asana, and after Vakrasana, they can go to Ardha Matsyendrasana. And then there is also another Gomukhasana that also is beneficial. Gomukhasana.
So some asanas can't be, performed by senior citizens or old people.
Yeah. No. See, senior citizens also, this Vakrasana which I am showing, which I am telling you, it's not so difficult. In the first day, they may not get they may not get full success. They can slowly bend their bend their body. I'll just show you, just like that. It is not a very easy asana, but it's not very difficult also. See, what you have to do is, you have to So now, for everybody to see, you sit with the back to the wall. For the time being, you can sit with your back to the wall. So now what I have done, I am folding my leg like this and keeping this leg is as much possible I can do. So somebody may say, I don't go this far. Okay, keep it here. Whatever, it does not matter. But I am folding and showing you the position. Then what you can do, you can do. Okay. Then take this thing. You can use these things to move this over here. Now, first maintain this position. Even this for some people may be difficult, but you can maintain it. Eventually, it will happen. Then what you do only like this. you do like this. You just go on doing like that, because I want this place to loosen up. Okay, now you have done like that, and then slowly you if you can, when you can get it in the vertical position, then that will be ideal. Okay, now this much I have come. Okay, now what I do, this is my left hand, this is my right hand, and this is my left leg. Okay, for the left leg, I have to take my right hand, slowly take it out and keep it here. Let it be like this for the time being. It doesn't matter. Okay, let it be like this. Then slowly what I will do with this hand, I am going on pushing this further and further. This may take 15-20 days to come to this posture. Does not matter. Time is not of essence. But you have to do every day. You do like this. You do like this and then push. Again, do like this. Push. Go on pushing. So like that, when you push like that, then you will see it is going down. So even this is enough. Okay. Then, so now this is to train. Now the real Vakrasana, when we do, we don't even require the legs to be this thing. We keep the legs straight like this. Okay, we don't require the legs to be bent. You keep the legs straight. That was for training. I wanted to train the body, so I did that. Okay, now in this again, I will train, push it like this, go on pushing, then take your hand like this, and then do like that, and then slowly, eventually after some time, with some force, you can touch the leg. You can touch this here. Okay, I can do it, but take some time. See like this. So this much if you do every day for both legs, you have to do on left leg and you have to do on right leg also, same way. Right leg, same way like that. Go on doing, and then you can eventually touch this thing. So this they can do. This is Vakrasana, very simple, but it takes time. Okay, so I just showed one. We will continue now with our lecture, because you see, here our whole group is full of yoga teachers and everybody. So everybody you can take help of some yoga teacher. You can see this video several times, and you can get this thing. If you are regularly attending our classes, you will get this video. Of course, you have to ask for it. Okay, now again I share. Okay, fine. Now again here it is. We have got a summary of differences. Very fastly I will read it, because they are all coming from above. One is sudden and it's gradual. Age group, children and young adults, but now here also mostly adults, but increasing in younger people. Then type 1 is normal or underweight, type 2 overweight. Type 1 is the cause is autoimmune destruction, type 2 cause is insulin resistance. Now type 1 ketoacidosis is very rare, very common. Ketoacidosis is very common and life threatening, whereas here it is very rare, etc. Fatigue is sudden and extreme, here gradual and persistent. Blurred vision, sudden changes, here it is gradual worsening. Nerve damage, rare in early stages, common in later stages. Dark infections and dark patches, less common, and here it is very common. And genetic influence is very weak, here it is very strong. Okay, now we come to neurotherapy. Okay, I see number of people are pleased. Very good. Welcome to all the newcomers. Okay, now neurotherapy perspective on type 1 and type 2 diabetes management. Now Lajpat Rai Mehra's neurotherapy, that is in short it is called LMNT. LMNT means Lajpat Rai Mehra Neurotherapy. LMNT. It focuses on restoring balance in organ function. That means we restore the organs to their normal functioning. And how do we do it? Through pressure-based stimulation. of specific nerve points. So specific nerve points and specific areas, let us say, specific areas. Okay. It focuses on stimulating specific points in the body to restore organ function, and by doing that, we also balance hormonal secretions. In diabetes, the key focus is on pancreatic activation. So where are we focusing? One is pancreatic activation, then improving insulin efficiency, then liver function, then digestion and insulin regulation. And as a result of all that, what we do, we regulate metabolism and we enhance detoxification. So these are all the methods which we are following in neurotherapy for diabetes. And how do we understand neurotherapy? Neurotherapy is a holistic treatment approach. Now, the word holistic means we look at the body as a whole. We don't say for left eye there is one doctor, for right eye there is another doctor, like that, or for the eye there is a doctor, then ear different doctor, then kidney different doctor. No, an average neurotherapist, once he goes through proper training, he will be able to treat any type of disorder in the body. Why? Because we are going to the fundamental root cause. Underline that, fundamental root cause of the body, we are setting it right. We don't go by symptoms alone. We bother about systems. We treat the systems, the symptoms automatically take care of themselves. So we treat not symptoms, we treat systems, but the symptoms automatically get benefited. So unlike conventional medicines that relies on medications or surgeries, neurotherapy works with the body's natural healing mechanisms. So that is it. Body has a natural healing mechanism of its own. So neurotherapy works on that. And it is a non-invasive, drug-free, and aims to address the root cause of health, what I told you, root cause, rather than just managing symptoms. So what are the key principles of neurotherapy? So first and most important, body is an integrated, it looks at the body as an integrated system. That is why it's called holistic. Okay. Then it views the body as a connected system where every organ and function is interdependent. That is the most important thing. When we work on one organ, we know eventually all the organs are going to get benefited. Understand? So it is not, that is why the time gap between treatments also is very essential. We sometimes say after 1 minute, after 5 minutes, after 3 minutes. The time gap is essential for the body to function to that level. Okay. So for an example, an imbalance in the liver may affect digestion, energy levels, and even the nervous system. That is why, though it is, we are saying though it is only liver problem, but due to that only the digestion is getting affected, energy levels are getting affected, fatigue is happening, and even the nervous system gets degenerated. Okay. Then nerve stimulation. The therapy involves applying pressure or stimulating points on the body linked to specific nerves. These points are chosen to influence organs and bodily systems. We have a treatment called medulla. This works on most of the cranial nerves. Okay. And it works on many other nervous system functions of the body. So that's all working with nerves. And we will be teaching all those things in our advanced classes. Then, for instance, pressing certain areas of the foot may help improve kidney function or relieve back pain. Okay. So this may self-healing mechanisms. The body has a natural ability to heal itself. Neurotherapy activates and supports this ability by removing blockages and restoring energy flow. Okay. So these are all the ways in which these are the key principles of neurotherapy. Okay, I will put it in one page. So these are the key principles of neurotherapy. Now let us see how does LMNT work. Lajpat Rai Mehra Neurotherapy, LMNT, is a specialized form of neurotherapy developed to focus on correcting imbalances in the body's physiological systems. So how the process works? Assessment of imbalance. First, we understand where is the imbalance. A trained LMNT practitioner begins by assessing the patient's condition, analyzing symptoms, and identifying areas of imbalance or dysfunction. You have all seen how Raghavan sir or Basavaraj sir, etc., Bhupender madam, all these, you have seen them, how they are treating, doing all this. They are identifying areas of imbalance and then or dysfunction by analyzing the symptoms. So similarly, in LMNT also we do the same thing. For example, if someone has persistent headaches, the practitioner may link it to tension in the digestive system or poor blood flow to the brain. So headache is not only a head problem, it can be linked to the digestive system. Here we will call it improper blood supply in the digestive system to the digestive, or poor blood flow to the brain. Then stimulation of nerve points. Okay, stimulation of nerve points. Specific pressure is applied to areas of the body wherever we say, such as the spine, abdomen, or limbs, to stimulate nerve pathways. So this we are teaching you in our classes. The stimulation helps regulate organ function. For example, pressing certain points near the thigh, improve digestion. Okay, near the thighs. For instance, pressing points near the thighs, improve direction on the thighs. Then restoration of balance. LMNT aims to restore balance between nervous, endocrine, and muscular systems. That is the very, very great important this thing. They aim to restore the balance between nervous system, endocrine system, and muscular systems. It ensures that organs work in harmony, impacting overall health. And then we have detoxification and circulation. So the therapy, see, much of these are known to people who are regularly attending my classes. But I am thinking today's class, there will be a number of newcomers who have not yet attended my classes. So some of this may be repetition for others, but others, for newcomers, they can understand how all we are working. Detoxification and circulation. So the therapy enhances blood and lymphatic circulation. That is the most important thing. We are enhancing blood and lymphatic circulation, promoting and elimination of toxins, and boosting nutrient delivery to tissues. So this is how we are working. And we make custom treatment plans. That means the same treatment is not given to everybody. We make a treatment for each person. Each patient receives a unique plan tailored to their health concerns. For example, someone with diabetes might focus on points that regulate pancreatic function and improve insulin sensitivity. So like that. So now let us see what are the benefits of LMNT. So benefits are many, many. I have just listed out a few. Number one, improved organ function. Stimulates sluggish organs like the pancreas or kidneys. Then pain relief. It alleviates chronic pain by improving circulation and reducing inflammation. I told you earlier, we have treatments which reduce inflammation. Then hormonal balance. helps regulate hormones for better energy, sleep, and mood. And it is non-invasive. That's the most important. Requires no drugs or surgery, making it safe for all ages, from children to adults, everybody. How diabetes affects the body. So now we have seen how neurotherapy is working. Let us now see how diabetes works in the body. And once for everybody, see the benefits are improved organ function, pain relief, hormonal balance, and it is non-invasive. These are some of the benefits of LMNT. Diabetes is like a chain reaction that impacts nearly every part of the body. Let us explore its effects with simple examples to make it easier to understand. So now let us see blood sugar and energy. So what happens in diabetes? The body cannot regulate sugar levels properly. This means cells do not get the glucose they need for energy. How do you give an example? It is like a car running low on fuel. So naturally the car starts coughing. Okay, if like that we feel tired, sluggish, and unable to function well when we are low on fuel. And our fuel is what? The glucose, and for which insulin is necessary. What is the impact? It leads to constant fatigue, hunger, and even confusion due to low energy levels in the brain. So what are the remedies? One is balanced diet. Includes slow digesting carbs like whole grains. Whole grains are a very good source of slow digesting fats, slow digesting carbs, and millets are the best. So millets are the best. Then exercise. Light activities like walking can help cells use glucose better, especially for type 2. Then damage to the blood vessels. This is the next point. So high blood sugar damages the walls of blood vessels, making them stiff and narrow. See, atherosclerosis it's called when the sorry. Sorry. When it is when the blood vessels becoming narrow, that is called atherosclerosis, stiff and narrow. That is called atherosclerosis. And this is a standard feature of diabetes, especially type 2. So this reduces blood flow to the vital organs. Okay, impact. It causes complications like heart disease, kidney failure, and poor wound healing. And I tell you, most diabetes, if they are on a long-term medication, they invariably have either kidney problems or heart problems or both. So this is why it is very essential to quickly resort to alternative healing modalities and get rid of your medications or reduce it totally, reduce it as much as possible. Okay. Then example is, think of the blood vessels highways. When sugar builds up, it is like traffic jam, slowing down the delivery of oxygen and nutrients to the tissues. And remedy, what is the remedy? One is monitor sugar level regularly, checking and maintaining stable glucose levels, and improve the circulation. Neurotherapy can stimulate blood flow and reduce complications. So this is the second one. Then the third one is nerve damage, neuropathy. Now excess sugar damages the nerves, especially in the feet and hands, and this leads to tingling, numbness, or pain. As I said, okay, more common when B12 is low. If left untreated, it can cause severe complications like ulcers or even amputations. That is called gangrenous foot. Okay, and gangrene, when gangrene sets in. So gangrene is when you have to amputate. But we have seen in our this thing experience, even the gangrene, if they come to us for treatment quite early stage, they don't have to get amputated. We can restore the tissues to normalcy. It may take about 1 month or so, but it can be done. Okay. Then imagine electrical wires covered in sugar. They stop conducting signals properly. This is what is happening in ulcers. Okay. Remedy: foot care. Regularly inspect the feet for cuts or sores and wear comfortable shoes. Okay. Blood sugar management. Keep sugar in check. Keeping sugar in check prevents further nerve damage. Then finally, one more you've got is diabetic retinopathy. And this is again, high blood sugar damages the tiny blood vessels in the retina, causing blurred vision or blindness. Okay. And impact may lead to vision loss if untreated. Example, it is like a camera lens getting smudged. The picture becomes blurry. And what are the remedies? One is regular eye exams. Early detection can prevent vision loss. And next is nutrient support. Foods rich in vitamin A and antioxidants that everybody should pay attention. Vitamin A and antioxidants, they are very beneficial. And the easiest way of getting vitamin A is eating all orange colored, like carrots, papaya, then pumpkin, yellow pumpkin, etc. These are very easy sources of vitamin A for us, for vegetarians. Then slow wound healing. High blood sugar impairs immune cells, reducing their ability to fight infections and repair tissues. So minor cuts can turn into serious infections if not treated properly. Example is, it is like trying to build a wall with weak bricks. The healing process is slow and ineffective. What is the remedy? Wound care: clean cuts promptly and use antiseptics, and boost immunity. Eat zinc-rich foods. And in zinc-rich foods, the one very simple thing, if you can eat eggs, then eggs contain zinc. Of course, then there are other these things also. Many other diet items can contain zinc, but eggs are very good source of zinc, I heard. So this is very good. And maintain good hygiene. Okay. Then, and in fact, when zinc is low in the body, then what happens? These nails, they start becoming thinner and becoming brittle. The nails are also due to calcium, but sometimes the calcium levels may be okay, but if your zinc levels are low, then the nails becoming thinner, they become thin, they become fragile. So that also we can understand is due to this thing, and by eating proper diet, we can improve it immediately. Of course, with the neurotherapy. Then why early management is crucial. Managing diabetes early can prevent long-term complications and improve the quality of life significantly. So here is why acting promptly is essential. Number one is preventing organ damage, because high blood sugar damages critical organs like the heart and kidneys and eyes over time. Okay. Then think of sugar as rust. It stays unchecked. It corrodes the body's vital systems. Rust corrodes iron even. No, iron produces rust, and rust corrodes the iron. So like that, think of the blood sugar as rust. And early management helps prevent this rusting process, keeping organs functioning optimally. Then reducing healthcare costs. Treating complications like kidney failure or heart disease can be expensive. Early action saves money by avoiding hospital stays and complex treatments. And finally, you have got the improving daily life. Managing diabetes early can reduce fatigue, improve mood, and restore energy levels. And example is a balanced diet and regular exercise can help you feel more active and engaged in daily activities. So now in Lajpat Rai Mera, what are the techniques for diabetes management? I'll first read out the important listings, then we will go to them. See, first one is stimulating pancreatic function. Then second one is stimulating, improving the circulation. Then the third one is reducing stress. And fourth one is enhancing digestive health. So we do these 4 types. Okay. So stimulating pancreas function, certain pressure points on the thighs, actually not abdomen, on the thighs and spine, activate nerves linked to the pancreas. Okay. Then this enhances insulin production, helping regulate blood sugar levels. We have got a treatment called 10-PAN that has been seen. The group has proved it, that 10-PAN immediately reduces the sugar level, even for chronic diabetes. Okay. Then improving circulation. The elementary techniques focus on improving blood flow to organs like the kidneys and liver. Then better circulation ensures nutrients and oxygen to reach the tissues, promoting healing and balance. So this you can understand. When oxygen reaches the tissues, nutrients and oxygen reaches the tissues, then the healing will start becoming better, and then you get balance in all the requirements, nutrients in the body. Then reducing stress. Stress can worsen blood sugar levels by increasing cortisol production. Neurotherapy includes relaxation techniques to calm the nervous system. Then example, gentle pressure points on points near the forehead and neck can reduce this thing. This is near the neck. This is called 8th medulla. I have written about this. I have shown videos about this. Then enhancing digestive health. So stimulating specific areas in the abdomen improves digestion, helping the body process nutrients more efficiently. Better digestion leads to stable energy levels and improved insulin sensitivity. So like this, so we are having four ways: stimulating pancreatic function, improving circulation, reducing stress, and enhancing digestive health. Now, this is the general neurotherapy principle. Now, for diabetes type 1 and type 2, what we do? Okay, now it is now almost 9:30. So I think we will go to this in our next class, because there may be questions. So we can see this thing. In the meanwhile, I will just show 10-PAN for newcomers. So for the time being, I am stopping share here. Okay. So now for newcomers who are not yet seen my other videos, very simple technique. Very simple technique. We are using our palms. Okay. But before doing this technique, tomorrow morning you do it if you like. You first check your blood sugar, because if you are already on some tablets, then if you do this technique at night, your blood sugar may come low, then you will not know. So better you don't do this during the night. You do it tomorrow morning. Understand? How to do it, I will show you. Then you can see, very simple. Now I am keeping my hands like this. I am going to press by the inside the palms here, this much portion. How do I press? Here is the groin. The groin, we all know the groin area. So keep your hands like this vertically. Okay. So it's very simple. Now you keep this vertically, it slightly lean forward a little bit. Okay. Now when I lean forward, naturally I get more pressure here, which is what I want. A little bit more pressure. So I lean forward and then say 1 1 1 2 1 3 14, 15, 16. Okay. Remove and again same place. 21, 22, 23, 24, 25, 26. Remove and again 31, 32, 33, 34, 35, 36. Remove again 41, 42, 43, 44, 45, 46. Again 51, 52, 53, 54, 55, 56. Again 61, 62, 63, 64, 65, 66. 71, 72, 73, 74, 75, 76. 81, 82, 83, 84, 85, 86. 91, 92, 93, 94, 95, 96. Last 10, 1, 10, 2, 10, 3, 10, 4, 10, 5, 10, 6. Okay, this all. You have to do this. This is called 10 pan. 10 pan. Do it 3 times with interval of 1 minute each. 1 to 2 minutes. You can keep gap. Do it 3 times. Tomorrow morning, you first check your blood sugar level. Then do this exercise. Then again check the blood sugar level. There will be at least a small difference. For different people, it may be, some people it may be more difference. Some people it may not have any difference also. That is also possible. Sometimes it happens. In case of severe insulin resistance, it can happen. But in general, it helps to everybody. So this is called 10 pan. Okay, now for in case, because today we have, so newcomers are there. So I request any newcomer, if you want any questions related to whatever we have discussed, okay, treatments will be covered exhaustively in the next class. Okay, how we are doing, etc. Okay, I gave you a small sample today, and we will be definitely covering treatments in the next class. So please, next class you keep coming in equal greater numbers, and then see, already a few people are leaving. So that's it. Doesn't matter. But they don't understand that anytime I can give any information. So they feel that the information is over, they have left. Doesn't matter. Now, anybody newcomer having any question about their diabetes, they can raise their hands. Newcomers first, then otherwise all the old people also, they can. If anybody has seen good results already, who is in my diabetic challenge class, if you are already seen any good results which you have not communicated earlier, you can communicate it now. That will also be very, very effective, so people can understand. Okay. So right now I see nobody raising their hands. So yeah, there is one person, Ravindranath ji. Since others are not raised their hands, Ravindranath ji always is there to give very good questions. Okay, sir, please unmute lower hand. Yes. Yes, namaskara.
Sir, regarding this weight loss, weight gain, normally diabetic, you lose weight, how that weight it will gain? That is my first question. Second question, is it type 2 diabetic causing obesity or because of obesity causing type 2 diabetes?
Very
Because
good question.
why I am telling my personal experience, when my BMI was less than 20, so I was not having any diabetic, or even my family, we don't have any diabetic this one. But due to stress in office or wherever this one, then I get into this type 2 diabetic. And my BMI also now it become 25, around 25, like 25, 26, like that. that means that area of the stomach, that obesity started. Is it because of type 2 diabetic I got this stomach bulging, or because of stomach bulging I got this diabetic?
Exactly. Because of obesity, only diabetes type 2 starts. That means if a person is careful about his diet and about his weight, then you don't usually become a diabetic. Understand? But the moment you have not taken care of your food, it may be because of food or not always related to food also. Some reason the body is putting on weight, and it can be due to not having enough exercise, the amount the body wants. See, you may be doing exercise, you may be walking, but that is not sufficient for your constitution. That may be one reason. So it is definitely the body weight and obesity contributes to a person becoming a diabetic.
See,
Now,
normally, whenever you are seeing any lean person, normal to lean, immediately they will tell whether you are having diabetic like that.
no. So that is this first I covered your second question. The first question will now come. Type 2 diabetes is based on obesity, okay, or is caused by obesity. Type 1 diabetes is obesity is not a real function. Type 1 diabetes, they are more likely to become thin. Why? Because type 1 diabetics only the ketoacidosis happens. What is ketoacidosis? As I explained, ketoacidosis means your body, where it should burn only sugar and get glucose, get energy, because the sugar is not able to burn because of the problem. It is not able to burn the sugar, so it is getting energy from burning lipids, fats. So when fats are burnt, then, or sometimes proteins, so proteins are converted and then burnt. So when fats are burnt for energy, then you produce ketones, and that is called ketoacidosis. And such people, because the fat is the one which is really contributing to the thinness or fatness of a person, isn't it? And so when they start burning fats, then they become thin and lean. So weight loss is more a problem with diabetes type 1, whereas weight gain is the problem with diabetes type 2.
But most of the people, when I've inquired, they have become thin, but they are type 2 diabetic.
See, some people type 2 diabetics also can become, they can have, that will be due to improper liver function. For them, if their diet is proper and they are becoming thin, then that means their liver is not processing the food properly. So they should take 1-point liver and they definitely get benefited. And they should check up whether they are having insulin resistance or not. For that, for individual cases like that, then we should have a 1-to-1, and then we can help all those people. Definitely. Okay. Very good. Anybody else having any question? Now it is 9:30. Anybody else having any question? Okay. Fine. Then in that case, I think everybody, I hope somebody will start taking this 10-pan seriously and do it tomorrow. Then I will show another one exercise. Then I will show another exercise, very simple exercise which you can all do before eating food. That is called CNG3. CNNS gas. What you do, those of you who can sit like this, those who cannot sit like this, for them a different technique. I will tell later. First, for those who can sit like this, you just place your hand very close to the ankle, and then keep your other finger here below on this side. Okay. So my hand is over here, and then I am pressing using this hand to other fingers are just supporting. Only this is the finger which is doing. Okay, this finger, the index finger. Okay. So what I do is I just press downwards and slowly go on pressing downwards, pressing. and come right up to the this thing, nail, big nail, up to here. Okay, so I come like that, and then I bend it downwards as much as possible. Hold there for 6 seconds. Again, slowly release it. Again, go back. Do the same thing again. Hold for 6 seconds. Again, third time. Hold for 6 seconds. So like this, I have done 1 round. You can do up to 3 rounds. This you will see increases your appetite, improves your digestion of proteins, improves vitamin B12 assimilation. So many things it does. So it's a very useful technique. If it is repeated before meals, you should do it. Now I said, what about a person who cannot bend his legs properly? Acha. So then for them, I will show here. You can do it. At least if you can keep your leg like this, is enough. Okay. Now I will show from one side. I will show from here, one side. Okay. Now I show from here. Okay. If you cannot fold your legs like this, I am showing, you can later on do it. Once you see the technique, you can do it. Now first we should start on the left leg. This is my left leg. So first we should start on the left leg. See, I am keeping my hand here, and then other thumb is over here behind. So I am pressing like this. I am pressing like this, and then bringing down. I do 3 rounds like this on one leg. Then I drop that leg down, and then so you can, those who are sitting on chair, they can drop the leg down and then do on the other leg. So like this, you can do 3 times. So 3 times on the left leg, 3 times on the right leg. And every time you hold for 6 seconds. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. So 3 rounds like that on left leg and right leg. 1 round, it's enough. If you do it every meal, it's enough. First day you may require to do 2, 3 more rounds. Doesn't matter. What all it benefits it does, it helps in belching. It reduces belching gas. It even reduces flatulence, gas from the anus. Even that also benefits. And then it improves vitamin B12 assimilation. It improves calcium assimilation. What more you want? It improves fat digestion also to a certain extent. So it gives you every benefit you require. So this is a very good technique. For anybody can do it. I request everybody to follow this. Do whatever other therapy you are doing, I don't mind. Please go ahead with your regular therapy. Add this. This is so harmless. This is so less time consuming and so easily followable. So all these things you have got. So you can start doing it, using it. Then you will get very great benefit. And then in the next class, I will teach you other techniques, what we do for liver, for kidney, etc. Okay. So I think that should be enough. Still we have got some time left. I will also show you for all of you the liver point, because liver is also very easy and very easy treatment and very useful treatment. Anybody can do it. Everybody should do it. I recommend that everybody should do this liver treatment. And where is it to be done? It is to be done only on left hand and left thigh, not right hand. Okay, not right hand. Only left hand, left forearm. This is left forearm, left thigh. So mentally, we divide the forearm into 3 locations. I am showing from here. Location 1, location 2, location 3. 3 locations. Similarly, the thigh, I divide it mentally into 3 locations. Location 1, location 2, location 3. But only thing, don't place it on the knee. Okay, don't place it on the knee. Place it slightly before the knee. So we start. How do we do the treatment? I have to apply simultaneous pressure over here and over here together. So how do I do it? I apply pressure like this, and with the bottom of my hand, this bone will press. It will give the other pressure. So I do like this. So I lean forward, 1 1, 1 2, 1 3, 1 4, 1 5, 1 6. Then I have to wait for 1 minute. In that 1 minute, I normally tell everybody, do normal, simple anulom vilom, or simple deep breathing is enough. Just go on. Inhale, exhale. Do 3 or 4 rounds. That will be 1 minute approximately, depending on your cycle. Okay, so that was first point in the liver. Then second point of the liver, I do, see, this was first point, this is second point, and here also I am doing the middle of the thigh, and every time I have to pull inwards because the muscle is pulling inwards. So I should not do like this. I should do like this. So I pull inwards like this. 2 1, 2 2, 2 3, 2 4, 2 5, 2 6. Okay, that's enough. Then wait for 1 minute again. So I did first here, then I did here. Now the third one is here, and here also in the hand here. So I pull inwards, 3 1, 3 2, 3 3, 3 4, 3 5, 3 6. So again, after 1 minute, I will repeat the whole sequence another 3 more times. So that is a total of 6 times we have taken the liver point. This is very good for a number of disorders, number of conditions. The liver is a unique organ. It does almost 1100 chemicals it produces, more than 1100 chemicals, and about 500 different functions it has. We are just able to touch the tip of the iceberg. We know only a few functions of the liver. But the scientists have determined that the liver can produce up to 1100 chemicals or more. And do you know what is the quantity it is producing in nanograms? Nanogram is 10 to the power 9. So you can understand 100 crore part of a gram is called a nanogram. And the liver has got another unique feature. You cut the liver, say 20-30%, you cut the liver and throw it away. It can regenerate. It can regenerate itself. So that is the strong friend we all have, the liver. So I expect everybody, whatever therapy you are doing, please go ahead and do it, but also add the liver point. You will see when I write, I have written in the group, some places I say, just take liver treatment. So liver treatment is very beneficial, I tell you. So you can all do that. So all of you, now we'll do another 3 more rounds, and then we can go ahead. We can call it a day. Okay. 4 1, 4 2, 4 3, 4 4, 4 5, 4 6. So this was 4 times we have done. Another 2 more we have to do. So again, wait for 1 minute. After waiting for 1 minute, now I will come to the middle point. 5 1, 5 2, 5 3, 5 4, 5 5, 5 6. And now, after another 1 minute, this will be the last. So 6 1, 6 2, 6 3, 6 4, 6 5, 6 6. Since we are at any time giving only 1 point, this is called 1 point liver. 1 point liver into 6. Very wonderful treatment, and definitely everybody should take this treatment irrespective of whatever problem you have. Strengthen the liver. She is your mother. She is like your mother or grandmother. So we should strengthen her. We should always pay attention to her. Okay. So now if anybody else has some questions, you can ask, or if you have any. Yasmin, yeah, very good. Thank you, Yasmin. Yes, please unmute and ask questions.
Good evening, sir.
Good
I
evening.
just wanted to know the pressure that you applied on the tarsal bone of the toe, it is to be applied on that tarsal bone of the big toe only, or on the sides or anywhere?
No. This is big. This particular treatment for improving stomach circulation is done only on the big toe. There will be
So
other
on the tarsal bone of the big toe.
Yeah.
Okay. Okay, got it. Thank you, sir.
Welcome. See, I will show you here. It is over here where we are ending.
I can't see you, sir.
You can't see it? Can
No,
you see?
your camera is not.
Okay, 1 minute. I will. I can see you, but you are spot. But you can't see me, is it? Okay.
No, I can't see.
Okay. I will first. Then I will have to remove you. I will remove you. Now can you see
now
me?
I can. Yes, yes, sir. Yes.
Okay. So now, this is the big toe, and this is the place where we are. This thing we are pressing. So we are doing from here, slowly coming up, and then slowly we are bending it downwards. That's all.
Okay. Matlab on the tarsal bone of the big toe, not between the tarsals, not between the tarsals.
No, not between, on the bone, on the right.
On the tarsal bone.
Yeah.
On the tarsal bone. Okay,
Yeah.
okay. Okay. Thank you so much.
Welcome. Yes,
Thank you,
Sharmila
sir.
Vivek, madam. Please unmute and lower your hand.
1 second.
Yeah.
Hello. Good evening, sir.
1 minute. I will try to spotlight you. Then later on, when you have to see me, then we will remove the spotlight.
Yeah.
Then it will be easy for us to add spotlight. Yeah. Yes, madam.
Yes, good evening, sir.
Good evening.
Sir, you have given this liver treatment. Okay, fine. So you have shown the thing also, but is it any terms or condition before food, after food, or this much of the times like morning, evening, yeah, like that?
Very good question. It is preferably before food, it is better, but you can do it even say 15 minutes or half an hour after food also, you can do it.
Okay.
And then you can repeat it several times a day.
How many times, sir?
Up to 6 to 8 times is very good.
Yes. As you told, liver is very important. So just I needed this answer. Thank you so much, sir.
Welcome. How did you find the class? Okay. Yes, now MS Rajeshwari, madam.
Good evening, sir.
Good evening.
Very nice session, sir.
Thank you.
So, I am following all your instructions and keeping the sugar level controllable. Doctor also appreciated that the sugar level and all that, that cardiologist and all that. And then the TNS gas, you told that one leg, left leg and right leg. But previously you told that 3 sides of the leg, isn't it, sir?
Yes. See.
Is it correct?
Yes, you are right. You have got, see, this is a general class for all.
Okay.
When we are going to tackle diabetes specifically, then 3 sides can be done.
Okay, sir.
But see, right now, you yourself know, in our main group also, diabetes group, not everybody was doing. They were all waiting for other people to give the verdict. Not everybody was doing. So I said that let everybody start at least with these basic things.
Something is better than nothing, you are telling.
Exactly.
Isn't it, sir?
Exactly.
Okay, sir. Another question, sir. You told that zinc item for egg. Vegetarian diet, what, sir?
Zinc. Vegetarian diet, we have to find. I believe there are some vegetables which have zinc. Vegetables and fruits. I did not collect the information, but it must be available in the group also. Joshi sir keeps putting, Anusha madam keeps putting. You just search zinc. somebody would have given the information,
Okay.
zinc, this thing. But
Okay.
definitely it is
Okay.
it is to be got only from the food. The body does not manufacture all these items.
And
Okay.
calcium and all that you told. Zinc also you told only egg. The other vegetarian diet I'm asking. That.
Yeah, no,
Okay,
that's
sir,
it.
I will see.
Yeah. I will also,
Okay.
in the meanwhile, if I locate it,
Okay,
I
sir.
will put it in the group.
Okay, sir. Thank
Yeah.
you, sir. So kind of
Okay.
you, sir. Very,
Welcome.
very informative and guidance. Thank you, sir.
Okay. Thank you. Thanks a lot. God bless you. Who else? Now,
Sir, finish the blessing, sir.
okay, I'll finish the thing. That's right.
Everyone, I request you to please ask your doubts in the group because it's almost going to be 10.
Yeah.
Please.
Okay. So, may God bless each and every one of us and our families with health, happiness, harmony, peace, prosperity, and success. May you all practice at least whatever I have shown. Please practice it and put your results in the group so that everybody can benefit. So with this, my heartiest blessings, my thanks to Joshys Kerala group, Joshi sir, Anusha madam, and all the team members who are working behind the scenes to make this a grand success. And I thank each and every one of you for being with me and listening to me patiently, and then also participating in the question answer session. Thank you very much. Once again, I bless each and every one of you and your families with health, happiness, harmony, peace, prosperity, and success. Thank you. Jai Hind, Jai Bharat, Jai Neurotherapy.
Gratitude, sir. Gratitude for this session. And firstly, those people who are here, please remember you have to request for the recording in the group, in the main group only. Then only the more you ask, the more people ask, then only the recording will be, placed. Otherwise, no recording. So please remember you have to request for the recordings, and then only it will be shared in the group. And I request all of you to please be regular in the sessions so that you can understand neurotherapy and follow it in your lives. And, you can get better from many other diseases other than not only diabetes, but some other root causes also will be cleared, and that will make your health better. So please concentrate. And from all of us, a warm thank you, gratitude, and everything to Ramachandran sir for today's session. And today there's no vote of thanks, so please share your vote of thanks in the form of messages in the main Joshys Telegram group, because all of you are just saying here and not saying anything in the group. So I want all of you to please share your vote of thanks in the group, because everyone needs to know what this session is. Otherwise, no one will know what is this session happening in the group. Many people don't see. So they should know how and why they are missing this session. So please share your vote of thanks, queries, and request for recording in the main group. Thank you so much. Good night. Happy weekend. And for tomorrow's session, please check the group if tomorrow's session is available for 7:30 p.m. acupuncture therapy. So thank you, everyone. Gratitude, sir. Good night, sir. Please take care. See you next Friday.
Yes.
Thank you. Everyone, tomorrow, please check the group. If class is available, we'll meet at 7:30 p.m. Till then, good night. Bye, everyone.
Bye.
Ending the session.